I grew up in Wilmington, Delaware. Ended up in New Jersey because my husband is from here. I first met Sid sophomore year of college at Princeton University. I've always wanted a family. So 2 years after we got married, we started thinking about starting a family. We had done 9 months of planning and we were ready to have our first child. A couple days before 38 weeks, I remember the baby's movement stopping. I called the doctor the next day on Monday and we went into the hospital and I was definitely in denial. I think my husband realizes that the nurse thinks something's wrong. And then they tell me that my baby's heart had stopped beating. After we got the autopsy results back, everything came back normal. Everything came back fine. And so I thought it was something I had done. As a mom, you feel like it's probably your fault, because if there was nothing, if there's no genetic issue, no congenital issue, then I must have done something. There are days I remember just crawling into the nursery that we had already set up. Everything was ready, and just kind of lying on the floor and crying because there was no baby and I didn't know why. 8 weeks after we lost Madison, we've received a letter in the mail. It was from the partnership. They were very, very sorry for our loss and were interested in speaking with us to learn more and to use that information to hopefully prevent other stillbirths. I was like, of course we have to do this. This is public health research. If we can avoid somebody else having to go through this experience, then of course we'll share our story. It makes such a difference to know that you're not the only one who's gone through this. The partnership has also put on some continuing education programs focusing on perinatal loss. They asked me to speak at one of the parent panels, and it was wonderful to see a room full of doctors and nurses who were there to learn. People are so receptive to each other's knowledge, and it's because of the partnership that they're all coming together in the first place. We waited 6 months, started trying again. Unfortunately, we were able to get pregnant right away, and Jackson arrived safely on May 31st, 2015. Just holding him was, any parent knows, it's just an amazing experience those first few minutes of life. The partnership for maternal and child health has meant so much to me personally, for reaching out to me during one of the hardest times of my life, listening to my full story, and using that story to help improve outcomes for other parents like myself. It's amazing to see the partnership being able to bring together all these hospitals and really make a difference in families' lives.